Hello everybody, happy Friday. Excited for the end of the week and excited for a good weekend. Hope everyone is doing well. Today I had a few patients ask me a few different topics that I'm going to kind of merge into one. There was an article from a few months ago that was being spread around recently talking about PRP treatments actually slowing down the progress of knee arthritis and pushing back the necessity for a knee replacement. So I'm going to touch on that briefly. And then I had some folks asking me specifically about how exercise and nutrition can actually help with our knee condition. So today I'm going to be talking about 3 tips to help us be proactive regarding our knee arthritis and our knee pain. So this goes broadly, this is beyond just the topic of knee arthritis. This goes and is applicable to many different conditions. Of course, the low back, the hips, the ankles, the feet, everything that's involved with us walking, but also other joints that we use on a regular basis: shoulders, elbows, ankles. Oh, I said ankles already. You get my drift. A lot of different joints that get affected by arthritis as we get older. But arthritis does not equal pain. We see patients all the time have arthritis conditions and have no pain associated with this. So what do we do to slow down the progress of our arthritis? What do we do to improve our pain? What do we do to keep active as we're getting older and as we have this dreaded wear and tear or arthritis affecting our bodies? So today I'm going to be talking about 3 tips to really keep proactive with our knees. So tip number 1, and this is something that actually is both counterintuitive and very, very logical if we really think about it, and that is exercise. See, the common misconception is that arthritis, being wear and tear of a joint, really happens when we are too active, or as we are active as we get older. But the truth is that wear and tear that occurs really ultimately occurs if we are moving improperly over time. Now, naturally, there's going to be some wear and tear of our joints as we get older in general, but how does that become an issue? How does that become painful? Really comes down to is how we are moving. So there's some interesting studies that look at things like the number of our stem cells within our knee joint. As we get older, that number of stem cells actually decreases compared to other areas where we have richer supplies, like the back of our pelvis. So that means that local environment, as we start to develop arthritis, that local environment in our joint is not as healthy overall. But that in itself doesn't mean that it has to become a painful joint. What that means is if we put abnormal pressure into the joint, it's easier for that joint to get irritated, and it's easier for that joint to stay irritated, right? So this is where exercise comes into play. Because theoretically, if we are moving our body correctly, then we're not going to put abnormal pressure into our joints. We're not going to irritate the joints, and therefore the joint's not going to become painful, right? So a very important tip number 1 for keeping our knee joint healthy is exercise. Now, when I say exercise, does that mean we could just do anything? There's a few different things that I think are actually fantastic when it comes to the knee joint. Number 1, walking. Really, walking is an underrated exercise, and this is something that could be done really by anybody, regardless of your age, regardless of your condition. Walking can be absolutely fantastic. For those that can do it and like to do it, running can actually be pretty good as well. But when we're running, we also have to pay attention to other areas, other mechanics. If we just pay attention to running, but we don't pay attention to certain things like the muscles across our buttocks and across our hips, then we can get into trouble by, again, causing some wear and tear inappropriately, or causing abnormal pressure into our knee joints. So there's a thing called runner's knee that can occur if we are running, if we suddenly increase the amount that we're running, or if we've increased the speed that we're running, and we're not paying attention to cross-training certain other muscles like across the buttocks. What happens with runner's knee is the kneecap, which sits in front of the knee, starts to glide improperly, and that gets irritated. Now, the old thought used to be, oh, that's because the inside of the thigh muscles are weak, or your ITB, your iliotibial band on the side of your thigh is tight. But in actuality, there's some interesting studies that showed that rehab exercises that not only focused on the knees, but also focused on the hip external rotators, the back of the buttock and side of the buttock muscles, would actually provide better relief to runner's knee. Why is that? Because those muscles of the buttock and hip are actually what are in charge of keeping the knees straight when we're moving. Because if we're not firing those muscles appropriately, then your knee actually rotates inwards. Your knee can actually bow inwards or get knock-kneed, and that can cause that kneecap to, in relationship to the knee, glide improperly and become a pain generator. So equally as important as doing things like walking, running, etc., is really strengthening the muscles of the outside and back of the buttock. Now, other exercises that are actually fantastic are things like squats, but we have to be careful about these. Squats, wall sits can be fantastic exercises for the muscles around the knees, but again, we have to pay attention to our form, because if we're doing a squat or if we're doing a wall sit and we're doing it in a manner that the knee is bending too much, for example, if we're doing a wall sit and our feet are too close to the wall and the knees are going past our toes, we're putting too much pressure into the knee joint. Similarly, and back to talking about the butt, if we're doing a squat or a wall sit, and when you're bending down, your knee actually goes inwards. I can't really do that. If you're bending down like this and your knee goes inwards like that, that's because the outside of your buttocks are weak, and that can actually cause abnormal pressure into the knee as well. So exercise, that's a really, really important thing for us to do. If you have a pain condition, then it may be a good idea to see somebody. Either see a physical therapist, see your physician, really get evaluated and make sure that we're doing the appropriate exercise to stay on top of the knee and make sure that it does not get worse. So that was tip number one. Tip number two for keeping your knee healthy is our nutrition. So this is something that a lot of people don't talk about, but I think is super important, is the type of foods that we eat can actually influence our pain. So how is that? I mentioned before that knee arthritis and degenerative conditions in general don't necessarily equal pain. I mentioned also that there are studies that show that as we have arthritis and that as we age, the bone underneath the cartilage inside our knee actually has less stem cells. What does that have to do with nutrition? Well, when we injure ourselves, let's say when you're a kid and you twist your ankle and that ankle gets nice and swollen, right? What exactly is happening in that situation? When you twist your ankle and have an injury, your local stem cells that are in and around that ankle joint then come to the area and call other cells to the area to get rid of the damaged tissue. That initial process of healing is called inflammation. So inflammation is a good thing. Inflammation is the first part of healing. But that inflammation still is technically a negative process, right? Because it's getting rid of the old damaged tissue. The analogy that I use and that I've used before is that inflammation is like the demolition day of a home reconstruction, right? It's getting rid of the old kitchen cabinets in order to lay down the new. But that inflammation should come and then it should go, right? That swelling in the ankle should come and then it should go. On a side note, this is why we no longer prescribe non-steroidal anti-inflammatory drugs when you twist your ankle, because that's actually going to stop the inflammation. That's the healthy first part of the healing response, right? So inflammation is good, but it should go, right? Now, what's in charge of that coming and going of inflammation? Well, that's your local stem cells that live in that area. And if we have arthritis, or as we're getting older, and if those local stem cells are not as strong, they're not as robust, they're not as abundant, then it's easier for that joint to get irritated, and it's easier for that joint to stay irritated. So that joint can get injured, and then instead of the stem cells causing and then taking away that inflammation can come and it could stay. So similar to my analogy about home reconstruction, right? Instead of this being a demolition day that comes and goes, this is a demolition day that stays. Instead of just taking off the kitchen cabinets, now we're taking off the drywall too, right? So that's what causes that arthritis to significantly worsen over time when we have an injury in a situation of arthritis. So what does this have to do with nutrition, you might ask? Well, what it comes down to is the type of foods that we eat may also have an influence in our body's disposition towards or away from inflammation. So what does that mean? The type of foods that we eat can actually cause inflammation to be better or worse. So if you have a joint that has arthritis, and if you get an injury or an irritation, then that inflammation comes, and your joint is already going to have a little bit of a difficult time getting rid of that inflammation. If we eat foods that actually are worse for our blood flow, that are actually showing in the research that could actually cause inflammation to be worse, that's putting fuel on the fire, right? That's causing us to actually, let that inflammation linger longer. That's allowing for less blood flow to the area. That's allowing for healing to not take place. So the type of foods that we eat are actually super, super important. So what are the type of foods that I typically recommend for patients that have arthritis or degenerative conditions? Really, if you have active, angry inflammation going on, we should be super clean, right? We should be eliminating processed sugars. We should be decreasing simple sugars like white bread, white rice, pastas, things like that should be decreased. Certainly starchier vegetables like potatoes and things along those lines. Some people argue that the nightshade vegetables should be decreased as well. We should be eliminating processed meats, decreasing heavier red meats. Supposedly chicken, fish are great. Fish supposedly is great. That being said, there's some folks that advocate that some people actually have a pro-inflammatory response to even things like chicken and eggs. So how do we figure that out? There are some that advocate that if we eliminate these foods from our diet and we try to add something back in, pay attention to how your body feels. Pay attention if you have increased pain. Pay attention if you have bloating or gas, if you're farting. Things along those lines may be signs that this is a pro-inflammatory food for you. Some folks have even said things like broccoli could be pro-inflammatory for some people. I think that there are some generalities we can say about nutrition when it comes to inflammation and in general. Things like processed sugars are probably not the best for us. But I think that nutrition really is a very individualized thing, and that's why grossly saying that this diet is great for everybody is kind of inappropriate. But we really have to pay attention to what may or may not work for you, but this is still an important part of dealing with the whole picture. Now, if you're not necessarily in active pain, then it's all right to have a slice of pizza, right? It's all right to have some carbohydrates and dairy or whatever. But we don't want to go overboard, right? We don't want that bad food to be our everyday meal. We want to balance that out with multicolored vegetables, raw or steamed rather than fried, cooked type of things. And we want to try to stay clean. And certainly if you are experiencing pain, then we really want to be as clean as possible, right? Now, that was tip number 2, but really combining tip number 1 and 2, exercise and nutrition play a really big factor also in weight loss. And when it comes to the knees, weight loss is actually a very, very important thing. If you are overweight, then really paying attention to cardiovascular exercise and watching your calories, and whether you do that by calorie restriction across the board or things like intermittent fasting, regardless, that plus cardiovascular exercise together can help us take off some pounds, and you know, there's all these various things about every pound that you lose takes X amount of pressure off of the knees, but ultimately any pound that you lose can help if you are overweight. On the overweight note, a couple things to consider. There's actually some interesting not a lot, but there's some interesting literature about you know, if you are overweight or if you're obese, then your circulating stem cells might not be as healthy. So I'm going to have to pull that research article, but it was something that was interesting that I read. I think it was last year. So how do we do cardiovascular exercise to lose weight if our knees are hurting, right? We can't exactly go running in that situation. 2 options that I think that patients really find beneficial are, number 1, if you have access to water, walking in water can actually be a really good form of exercise. Take some pressure off of the knees, but still provide some cardiovascular exercise. And number 2, there's a thing called a pedal exerciser. It's like a little exercise bike in a small device. There's several different versions of it available on Amazon or in various different retailers. But ultimately, this is an exercise bike device you could put on the ground and use your feet to pedal, or you could put it on a table and use your arms to pedal. And better believe, do that for 10-20 minutes, you're going to work up a sweat, right? So that was a little combination of tips number 1 and number 2. Tip number 3 for keeping your joint healthy, and this goes back to what I first mentioned when we started this segment today, is that there was a really interesting article that came out this past year, or this year, that talked about how PRP treatment could potentially slow down or push into the future the necessity for something like a knee replacement. So this was a really interesting study that looked at over 600 people. It was a retrospective study, meaning it was looking back at records of over 600 people that had pretty severe knee arthritis and ended up going through a knee replacement surgery. And those that had PRP actually were able to delay the necessity for surgery for over 5 years. This is actually really interesting, because we've seen it in the literature in the past how PRP can help knee arthritis in terms of pain, in terms of function, right? There's over 30 randomized clinical trials that look at the use of platelet-rich plasma against cortisone, against gel injections, against saline, placebo injections, and they show that PRP is beneficial, specifically for mild to moderate knee arthritis. As we get into the severe arthritis territory, things start to drop off a little bit, and we could talk about that at a future date. But the point is, we have pretty robust research at this juncture suggesting that PRP could be beneficial for knee arthritis. We presumed that it can help with keeping the joint healthier. At the very least, we know that it's not dangerous the way that corticosteroid injections are inside the knee, right? A cortisone injection can decrease knee inflammation and decrease knee pain temporarily for a few months. But ultimately, the research shows that repeated injections of cortisone actually decreases our cartilage, so it makes our arthritis worse, right? So PRP, at the very least, we knew that it wasn't doing that. But there was many of us that presumed that it can actually help with keeping the environment of the knee more healthy. Well, this research article was really fascinating because it showed that, right? It kept the knees healthier and was able to delay the necessity for a knee replacement surgery for 5 years. So that's really fantastic information. Where have we seen other information long-term about orthobiologics, or using your own body's healing cells and growth factors for knee arthritis? Well, this year also gave us 2 really great papers that were published by one of the forefathers of regenerative medicine from Europe, Dr. Philippe Hernegue, who published 15 years of data, 2 different publications. In one research article, he compared people that had knee arthritis in both knees, that either had bone marrow cell treatment just inside the joint, or bone marrow cell treatment inside the joint and inside the bones, where we know that the stem cells are actually decreasing in quantity. And when he injected into the bones where those cells actually were, he actually had more significant benefit, and again, a slower necessity for a knee replacement surgery. The second study, which I think was actually really fascinating, looked at patients that had either knee replacement on one knee or they had a stem cell treatment on the other knee. And they actually, both knees ended up having benefit. A chunk of patients actually preferred the knee that had no replacement, the knee that had the stem cell treatment, they preferred more so. So really fascinating stuff that has been coming out in the research. And as there's more research that's done, we're starting to realize that these orthobiologic treatments are not only potentially beneficial for joints like the knees, but also could potentially slow down the progress of arthritis and potentially delay the necessity for something more drastic like a knee replacement for more severe joint conditions. This is really, really important for us to really acknowledge, internalize, digest, right? This is really important because the fact is, when we have knee arthritis situations, if we're doing everything right, if we're eating properly, if we're exercising, and if we're still feeling pain associated with that knee, we only have a few different options at this juncture. We could do things like a corticosteroid, a cortisone injection, to calm down the inflammation of that joint, but that'll only last for a few months. And repeating that will make the arthritis worse, right? If we have degenerative meniscus tears as a part of this arthritis, we can get an arthroscopic surgery to clean up the knee, which sounds fantastic, right? Who doesn't want a sparkly clean knee? But that would ultimately remove some of that shock absorber degenerated meniscus, and the research in that regard shows that a fake surgery could just be as good as a real surgery, and doing a arthroscopic surgery for degenerative meniscus tears may actually make the arthritis worse, right? It's removing some of the shock absorber. Then we have things like knee replacement, right? Not a lot of options in the traditional care that's out there, but PRP is actually a very reasonable option. Using your blood growth factors may be able to help significantly, especially for mild to moderate arthritis, but even for severe arthritis may be able to slow down the progress of disease. Bone marrow stem cells, again, this kind of goes more towards the severe aspect of things, but could be a very reasonable treatment option for select patients. So overall, in conclusion, my 3 tips for keeping your knee healthy, for being proactive about your joint as we're getting older, as we're continuing to be active, is number 1, exercise and making sure we're doing the appropriate exercise. Number 2 is paying attention to our nutrition. And 3, especially if we're having pain conditions, thinking about using orthobiologics, your own body's healing growth factors and cells, might be a better, safer, and more proactive option for your joints rather than traditional things like cortisone and surgery. So I hope that all made sense. I hope I answered the questions of those folks that were asking me to talk about these topics. Keep in touch. If you have topics that you want me to talk about, comment, DM, email us at info@stemcelldrpatel.com. You could feel free to reach out to my staff in any way, shape, or form. Reach out to me. I'd love to hear from you. I hope you guys are staying safe. Stay active, stay healthy, and have a great weekend.